One thing that now we've started with Toronto, we have our community health worker initiative, and that's a prime example of keeping care close to home. They don't have any medical facilities. They have a senior center, but really no health care within 30 minutes, honestly, is the closest. So they have a deep desire to stay in their rural community, and having that community health worker, a trusted individual that can meet them where they're at and see their needs and connect them to health and community services.
A large collaborative K-State 105 project is keeping care close to home through a pilot project that's bringing together 12 partners, including Kansas State University, other higher education institutions, and health organizations to improve rural and agriculture-connected health across the state. The Rural Ag Health Community Health Worker Project focuses on sustaining the health and safety of rural Kansans and the agricultural workforce. The project is establishing resource and service hubs staffed by community health workers who are co-supervised by local K-State research and extension units and healthcare partners. The project, which has received funding through K-State 105, is designed to help rural residents manage chronic conditions, prevent injuries, and reduce risk of illness. On today's Sound Living, promoting community health in the Southwind Extension District. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Southwind Extension District Family and Community Wellness Agent Tara Solomon Smith is working with Extension's Community Health Worker Pilot Project in Allen, Bourbon, Neosho, and Woodson counties to plan, implement, and expand local programming and partnerships for health improvements in her district. Tara, first off, maybe a little bit of background on what you've been doing so far. I understand that you work kind of on an individual level programming, then also on a community level programming in those 4 counties.
Yeah, Extension is an exciting career because you do get to both do direct education as well as larger community level work that really can create lasting change. So we do provide evidence-based programming such as Stay Strong, Stay Healthy in all 4 counties, as well as one-on-one assistance on health insurance counseling and other programs such as QPR, suicide prevention education. But then on the community level, you get to work with others and really assess needs in a community. For example, we've worked with rural Woodson County and looked at Kansas Health Matters Health Equity Index and focused in on a community, Toronto, within Woodson County, working with my other coworkers and started a Let's Talk Toronto initiative. And what came out of that conversation with the members of the community, we've worked on enhancing civic health in the development of a community center and hub, and then also accessibility within the community.
How did all of those conversations get started with Toronto?
So again, we focused on Toronto a little bit based on needs. Our SNAP educator had a wonderful connection and trusted relationship with community members, so it really brought out a lot of participants, and we just had a meal and a conversation looking at strengths and opportunities of the community.
You mentioned the community center. I'm assuming that was something that was not in that community and something that the participants felt should be in the community?
Yeah, so they have a previous school gym that is a community center that they've worked towards local activities and gatherings, but making it more a health initiative in some realm. They've had some farmers markets there recently, and that's been new. We've connected with other grant writers to assist in a playground for the youth in the community.
So how important is that, I guess, to get the community buy-in to try some new programs?
You know, it's all about the people. They have extreme pride in their rural community, and so you do want to work alongside them on this initiative.
If you could go into a little bit more detail in terms of what they can do now that maybe they weren't able to do. I'm assuming that they were looking to maybe expand their options for health care and some other issues as well?
Sure. One thing that now we've started with Toronto, we have our community health worker initiative, and that's a prime example of keeping care close to home. They don't have any medical facilities. They have a senior center, but really no health care within 30 minutes, honestly, is the closest. So they have a deep desire to stay in their rural community, and having that community health worker, a trusted individual that can meet them where they're at and see their needs and connect them to health and community services.
Go into a little bit more detail about the community health worker, because I'm not sure that people fully understand what they can do within a community. How are they able to really help the residents?
Yeah, so we're excited to be a part of the Rural Ag Health Community Worker Initiative that's received funding and support from K-State 105, which is an economic growth and advancement initiative for all 105 counties in Kansas. And the healthcare worker provides outreach, education, and that link to healthcare community services. They work with the individual and really empower that individual to set goals for themselves around their healthcare and well-being and help them work towards those goals. It's really a consumer-led, that client-led initiative.
So it really starts out on the individual level, but this is something that really is done community-wide. Anybody who wants to meet with a community health worker can do that?
Yes, that's correct. And we really have our community health worker works alongside our agents, along with our education, to then connect with consumers as well.
How important is that educational aspect? Because I think sometimes when it comes to healthcare, we don't always have the information that we need to maybe make some decisions that would improve our health.
Yeah, definitely. There's probably a wealth of information out there, but is it coming from a trusted source? So K-State Research and Extension's education can be that trusted source.
I would imagine that as time goes on, they also begin to really form a relationship with that community health worker, so they are able to, as you say, trust them with the advice.
Absolutely. I know that, some things you do want to keep private, but then that doesn't move you forward on health. So, yeah, having that one-on-one, personal, confidential, and trusted relationship is important.
Are there some things within the 4 counties that you've picked up on from some of the data that's been released that maybe helps you to decide which direction you should go with some of your health programs? Are there some real needs in the communities that are not being met?
Oh, yes. There's always something, right? We can combine our direct ed with social determinants of health. For example, worked with a health coalition in one of our counties and presented the Pathways to a Healthy Kansas and tailored that activity to do a deep dive into their local transportation issue, which they wanted to address. And so after that assessment, we were able to come back with an action plan on how to address, by whom, when, evaluate, and eventually work on sustaining.
That's one of the issues, too, is you have to find a program that not only works immediately, but is a long-term project as well?
Yes, some of those that work towards social determinants of health takes time.
When we talk about the social determinants of health, we're talking about things that are not necessarily health-related, but impact health maybe through things that happen within the community or don't happen within the community. These are kind of outside factors?
Yeah, you're correct. Such as the transportation, the housing could be an issue, the environment is an issue, lots to consider.
In terms of the people that you work with, I'm assuming that these are mostly older adults, or is this a mix of the entire community?
Yeah, it's definitely a mix of the entire community. Depending on, some of our programming is geared towards older adults, but we are open and able to fit the needs of all ages.
In terms of just kind of what you would recommend to others who are looking to do something similar in their communities, what are some things that they really need to keep in mind that will maybe make this an easier process and a longer lasting process?
Yes, that's a great question. The avenue that helps a lot is definitely our local coalitions. We're all better together, and other people in our community have their own understanding of issues based on those they serve. So it's definitely important to have that collaborative connection and work towards these long-term goals of health.
How were you able to get partners to come in and collaborate with you? What was that process like? Because I'm assuming that you probably had some targets to begin with, but sometimes those don't work out and you have to go to a plan B.
Sure. Some communities have something established, and others may have a group of people but hasn't had a particular goal that they're working towards. So really honing in on what we want to address and looking at the local data to see the needs to help you narrow down what you want to address at this time makes a big difference.
There are some things we consider to be chronic conditions. Is that one of the areas that you focus on too? I know hypertension has been in the news a lot lately and something that Extension has also started to play a larger role in looking at.
Yeah, I'm glad you mentioned that because one of my near future goals is to launch the HAP Works, the Hypertension Awareness and Prevention Program, with a local business. Hypertension does affect more than 1 in 3 people that are over 45. So a self-measuring blood pressure program and education empowers individuals to take charge of their health and well-being. And we do have some bigger industries that are interested in this HAP Works program that we hope to launch by March.
The idea is that we can educate and then we can hopefully reduce some of the issues that they have long term, right?
Yeah, that's right. To help hopefully prevent as well as manage. A lot of that, it's an 8-week series, and there's different topics as far as looking at sodium content of foods. Things such as sleep is important in a lot of issues, not just hypertension.
There are a lot of programs that Extension does offer that are just kind of standalone programs. So those are things that you offer as well?
Yes. There are some things that are a one-time program that still serves a very important need. We do a Medicare Basics program for those that are going to be new to Medicare. We do programming around looking at your property and how you want to disperse that personal properties and items, disperse that with your family. Stress Less with Mindfulness is another one-time program that we offer.
And I know you mentioned it earlier, but the SHIC programs and things that help people with the right insurance and the right programs is very valuable, especially for those who are maybe just entering that retirement phase.
Yeah, it's important. In that time, you may have limited income. And so being able to make the most cost-effective insurance decision based on your personal needs, as well as being able to make your health a priority. It's a balance there, and we're able to assist people in making that happen.
What's the reaction been so far within the communities when you bring in the community health worker, when you let them know that you're here to help them with some of their health needs? What's the reaction been?
It's been very positive. I think that we've had a great response. Our community health worker has done a great job in marketing and has received phone calls based on that.
What do you see maybe in the future? I know you talked about the hypertension awareness, but what are some other programs that you think might be worth exploring in your counties?
I'd love to do an Empower Caregivers program for those that are maybe in that sandwich generation, caring for kids and older adults, as well as our community health worker has lived experience in caring for special needs children. And so helping to support those parents is something new that we're exploring.
I know the Community Health Worker Project is just kind of a pilot project at this point, but it sounds like something that is probably eventually going to expand across Kansas.
Yes, there's been great response in this initial pilot option and definitely interest in expanding it across Kansas and maybe even in other states.
Yeah, I know one of the big issues, like you mentioned before, is the transportation and just the fact that some of these people are so isolated, and being able to do things within their community makes a lot of sense.
Yeah, having that avenue right there close to home definitely is important.
And Extension will continue to play a big role in this, you think?
I think so. We're already trusted individuals and communities, which only enhances that opportunity.
That's Southwind Extension District Family and Community Wellness Agent Tara Solomon-Smith. In addition to Allen, Bourbon, Neosho, and Woodson counties, the Community Health Worker Project involves work in Clay, Cloud, Crawford, Jackson, Jefferson, Labette, Marshall, Montgomery, Nemaha, Republic, Washington, and Wilson counties. To learn more, search K-State 105. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.